Hi everyone, here's Dr. R. Today we're going to do the part 3 continuing review of this masterpiece of an article made from the American Academy of Periodontology, the European Federation of Periodontology. They made a consensus report between cardiovascular disease and gum disease. So let's get to it. After reviewing everything, how gum disease can be correlated to cardiovascular disease and how one can influence each other, they came up with some recommendations. They divided between recommendations to the dental professionals, recommendations to the medical professions, and recommendations to the patients in general to know what to do about. For recommendations for the dental professional, once the patient is diagnosed with gum disease, they should be checked for the risk factors of cardiovascular disease. Some of those being high blood pressure, diabetes, obesity, smoking. All those things should be part of a regular medical history review that is common use on any dental practice. But more attention should be paid to that, saying, look, you have gum disease, you have higher chances of having cardiovascular disease. How are those factors? And if anything is off control, they should be recommended to see a cardiologist. We're going to talk second about recommendations to the patients. Patients that do know that they have cardiovascular disease, being for history of heart attack, stroke, blood pressure issues, and things that correlate to cardiovascular disease, they should be aware of problems with their gums, swollen gums, bleeding gums, if they haven't had their teeth checked or their gums checked in many years, if they haven't had the regular cleanings, or if they're not performing the regular home care, we should be brushing at least twice a day and flossing at least once a day. Those are the things they should pay attention to, and they should seek a dental professional as well to look into those things and see what's needed to stabilize their mouth. Now let's spend a little bit more time on the patients. They are cardiovascular disease patients, they're at the doctor's office, they made up some questions why they should seek for dental care. So first question is, why should I have my gums checked? You should have your gums checked because it's well established that patients that have cardiovascular disease, they have higher chances of having gum disease. And the earlier you are evaluated for it, more successful the treatment should be. Another great question is, what should I look for that will tell me that I have gum disease? You should look into red swollen gums. You should look into foul taste, bad taste in your mouth, bleeding after brushing your teeth. After brushing your teeth, if you see blood on your sink, that's a sign, a strong sign of gum disease. Loose teeth, teeth that are shifting, they're drifting to different positions, tartar, plaque around your teeth. Those are all signs of gum disease and you should be evaluated for it. A follow-up question was, can I have gum disease without these signs of gum disease? Or I should say strong signs of gum disease, and the answer is yes. You can have gum disease on early stages that they will not show as strong of signs that you'll be able to perceive on your own. That's why yearly checkups are very important to make sure any gum disease problems or any dental problems in general, they're caught early. Treatment tends to be much easier, much less invasive and predictable that way. And the last great question was, how can I prevent gum disease? And then we'll circle back on things we mentioned before. You should brush your teeth at least twice a day for at least 2 minutes. You should advise to clean interproximally. Most used and recommended is the dental floss. In addition to that, you should use a mouthwash. You should have your cleanings at least every 6 months, and you should see a dental professional at least once a year. These recommendations are the most established recommendations to prevent not only gum disease, but any oral problem altogether. So you should follow these recommendations to help to keep your mouth healthy and your body healthy.